AIDS is a culmination of the disease process, which is caused by a virus called HIV, human immunodeficiency virus. So, after somebody gets HIV infection, after several years, the person may get HIV disease, where there are some symptoms like fever, cough, loose motion, weight loss, some internal diseases, and that is at that time it is called HIV disease. But when the person start getting internal diseases, secondary opportunistic infections, they are like tuberculosis, PCP pneumonia, some brain-related issues, abdomen-related issues. That time it is called AIDS.
So the patient who has AIDS might present with lots of symptoms, predominantly high-grade fever, lasting for months on together, sometimes loss of weight, loss of appetite. They might get a lot of bumps and swellings all across their body, known as lymphadenopathy. They might get some whitish patches over their tongue because of some fungal infections. These are the general causes, these are the general symptoms of patients wherein we suspect AIDS. Advanced stages of HIV is called AIDS. If HIV is caught early and it is treated appropriately, then in those particular patients, there will be no such symptoms per se. If HIV is detected early and is treated in a timely manner, then in that particular case, the immunity of the patient will not go down and the patient can lead a full and healthy life. So not all HIV patients need to present like AIDS.
HIV is not transmitted through any of the day-to-day contacts, sitting together, eating together, hugging each other, or even kissing. HIV is transmitted only through intimate sexual contact where body fluids are exchanged. So it will be transmitted through either infected semen or infected vaginal secretion. Similarly, it can be transmitted through blood and wound. So basically, during sexual activity, there could be microscopic wounds, and from there there could be oozing, and that blood which is contained having a virus can be transmitted to the other partner, or it can be transmitted through blood transfusion. If mother is infected and not treated for HIV, she can transmit the HIV infection to her unborn child either during pregnancy or during childbirth or during through breastfeeding. And the last way of transmission is the accidental transmission through surgical procedures or needles and syringes which are contaminated. Unfortunately, this myth is being carried on for more than 3 decades. The initial cases of HIV were found in America, particularly California, where six homosexual people or male having sex with male having similar illnesses like PCP pneumonia and Kaposi sarcoma, a type of a skin cancer. They were found positive. And thereafter, it was thought that it is only MSM, male sex with male, and that is being considered that is a risk factor. Within a couple of months after that, even heterosexual people started getting HIV. Ultimately, it ended up in most countries like India, almost 85 to 90% transmission is heterosexual, 3 to 4% is homosexual.
Unfortunately, because of the stigma associated with homosexuality in our country, patients generally do not really access the healthcare as often as they should, as a result of which they sometimes might miss out on this particular diagnosis.
A person who is HIV positive under treatment and having control viral load for more than 6 months or 1 year can marry, cannot transmit HIV infection to the spouse. And similarly, if the lady is pregnant, she is HIV positive, and viral load is controlled, she cannot transmit HIV infection to the child. So there are two ways to look at it. Number one, can HIV positive and negative person marry? Yes. Number two, can HIV positive couple or HIV negative husband but HIV positive wife can have a child which is HIV negative? Yes, 100%.
Certain precautions that can be taken from your side could be: first thing, prevent getting AIDS, is pre-exposure prophylaxis that can help in preventing getting HIV altogether. Frequent testing, early acceptance of this particular disease, early approach to healthcare, and early treatment. I think these are the basically four mantras which can help in preventing the progression of HIV to AIDS.